morning. I'll be your doctor and I'll, pop in.
Okay.
All right, I'm going to go ahead and give you a report. It's Thursday at 1900. The patient that I'm giving to you and you're assuming care of is Arthur Harris. He's a 59-year-old male, came in with an infected sacral wound and diabetes type 2. And his backstory, he was hiking and twisted his ankle a few months ago. Because of that, he's not been as mobile. He's been sitting a lot and he wound up getting this wound that I don't know if he's got peripheral neuropathy, but he didn't feel it. So it's red, it's swollen, it's draining. He's came in yesterday, so he's had 24 hours of antibiotics, and his white blood cell count at this point is decreasing. Okay.
Which ankle is the wound? Or I mean the sprain?
On the right.
Okay.
And then his sacrum is his wound. Mm-hmm. His wife died 6 months ago, so I just think he's, just not caring for himself. His nutrition's really poor. He's very labile about his diabetes care. His blood sugar's been running in the 200s. I last gave him insulin 6 units about an hour ago for a blood sugar of 206. Okay. Lungs have a few little crackles in them in the bases. Heart tone's S1, S2. He's been a little tachycardic, 90 to 100 depending on his pain level. Okay.
Any drug allergies?
He's allergic to cefazolin. His last bowel movement was today. He's tolerating his ADA diet without any nausea or vomiting. He has no peripheral edema. He's got 2+ radial, 2+ pedal pulses. He last had hydromorphone 2 milligrams about 2 o'clock today for me. He has an 18 gauge in his right forearm AC area that he has NS running at 125 mils an hour. Outside of that, he's awake, he's oriented, he's a little unstable when he's up because of that ankle injury. He has a friend who was at the bedside that's a companion, but he's not here right now. He left to go eat. Any questions for me?
Code status?
He is a full code.
And incentive spirometer use?
He doesn't have one at the bedside.
Okay.
Actually, I'll give you somebody else. It's probably in that cabinet there.
We can go with it.
Perfect.
Okay.
Any other questions?
Bathroom. Urinal.
So he does use the urinal, and like I said, he's a little unsteady up with that ankle.
Okay.
And he can be impulsive with that too. So I reminded him to use the call light when he gets up and all that.
Okay.
So now do we go out and come in?
No, you just
Stay in here?
Yeah.
Okay.
Sweet. Thank you. Bye, Dede.
Thank you.
All right, ready? Good?
Yeah.
So we have to wait for you to say anything? No?
There's a 2 second delay.
Okay.
Hi, Mr. Harris. My name is Crystal, and this is Dede. We are going to be taking care of you today.
Hello, Mr. Harris. How are you doing today?
Okay.
Do you have any concerns or
I don't know. I'm in a pain. I'm hot. I'm sweaty. I don't know how I am.
where's your pain at?
My pain's on my butt. And I don't know. I just buzzed.
And from a scale from 1 to 10, 10 being the worst, how would you rate your pain?
You know what? I can't even put a number on it. I don't know.
Don't know? Okay. Well, let's take a look at you. Let me just wash my hands real quick here. And you're feeling
Okay,
hot?
thank you. Yeah, I just feel hot. I'm I don't know. I feel sweaty. Am I hot? Maybe I have a fever again.
We're gonna check you.
Vitals, I'll do the assessment, yeah?
Okay, let's have you stick this under your tongue.
So his temperature is 99.1.
All right. So not too bad. 99.1. Let's get your blood pressure and see what's going on over there.
Mr. Harris, I'm just going to listen to your heart, okay?
I'm giving you your blood pressure reading.
Okay.
A little cold.
All right, so blood pressure.
Blood pressure. Go ahead. I don't know what's going on.
So 156 over 93, a little elevated. Pulse 116.
That was kind of high for me, you know, man. I couldn't
What do you
even think.
usually run, Mr. Harris?
No, lower than that, but I just can't even, I can't think.
Okay, so the last time you had pain medication was at 2 o'clock.
Let's see.
Well, I'm sure I need more of that, but
I think Crystal's looking in the computer right now to see when you're due for your next. When was the last time that you ate something?
they brought food, but it's awful. Have you had the food here? It's terrible.
Well, we definitely want you to keep up your diet, especially with that wound healing on your back. That's really going to help you heal faster, okay? So,
I just can't even think about
can't think about it.
Sorry.
Can you tell me your full name and date of birth?
Karen,
And can you tell me where you are?
date, I don't know, June 12th.
You are sweating.
Oh, it's hot in here.
Yeah, you know what, Mr. Harris? Let's check your blood sugar and see how you're doing.
Okay, oh, that felt really good. Wiping that off.
So 1,700 4 times a day. I don't know. There's nothing. Zofran is the only thing that's scheduled. So while you're doing that, he's feeling.
Take this off blood sugar?
Yeah, we're gonna check your blood sugar.
So I'm gonna get a wash rag, that'll help.
So what's our blood sugar reading?
You should get a number.
What did you say? Did you get a number?
E11.
So it's low.
Blood sugar is 56.
56. Okay. Do you have any problems swallowing?
Right now.
Well,
Mr. Harris?
we need to get that blood sugar up, so
I don't want to, I'm just so sick to my stomach, I just can't.
okay. Do you think you could drink some orange juice or some milk for us?
Uh-uh.
So we need to call the doctor, get an order for, I'm just gonna leave this, I'm pretending this is a
Well, we need to get you some insulin because your blood sugar is too low. 4.
You gonna give
Subcutaneous.
me what?
We need to give you some insulin. Or where's the? I'm just looking at your orders right now.
And it's the only thing that was due in there, it looked like was the Zofran, so.
Subcutaneous. 4 hours. See the instructions.
All right, Mr. Harris, I'm gonna go ahead and lay the bed down for you. Do you feel like you need to vomit?
I don't know, I don't know.
Not feeling
I
well?
keep laying my head down because the room's starting to get dizzy, I don't know.
Okay.
Oh, so no insulin. Where is the orders? We need to call the doctor.
Go up to the left, on the left-hand side. I didn't see anything.
Okay,
Alright,
you know what,
I'm
Mr.
gonna lay
Harris?
down.
I'm gonna call your doctor, okay? Because I don't see any orders in here. Go control.
Here. Is that a little better for you?
Yeah, that might be a little better.
Okay, so I think he had Zofran. We can do the Zofran because it didn't, oh no, wait. Every 6 hours and he hasn't had it yet. So let's do,
Oh, I'm waiting for when you call.
Oh,
it looks like he hasn't had his Zofran. We can do the Zofran for his nausea and then get an order for, isn't it glucagon, IV? Glucose.
Or just call your doctor
Okay.
now.
So
ring, ring, ring.
Hi, this is the healthcare provider.
Hi, this is Jerry. We're here with Mr. Arthur Harris. He is a 59-year-old male. He came in for the sacral wound,
Uh-huh.
and his blood sugar is 56 right now. And he doesn't want to eat or drink anything.
Is he symptomatic?
He is. He's feeling hot. He's sweating.
Is he tachycardic?
He is tachycardic. His pulse is 116. His blood pressure is 156 over 93.
Okay, let's go ahead and do this. Since he's not eating or anything, let's go ahead and give him 1/2 of an ampule. 50% dextrose IV now. Repeat the blood sugar in 15 minutes.
Okay.
And if it's still below 60, you can give him the other 1/2 an ampule. And just repeat it every 15 minutes until he's stable.
Okay. Thank you, doctor.
Thank you. Signing it, Jane.
This one, because you guys have it all. Yes, thank you.
Did you find it?
So I'm gonna need the flush, I'll have the needle, I'll put that away. Because it is,
Where's the ampule?
did she say what kind of morphine? Or, I think. Insulin?
No, she said an ampule.
Okay, Mr. Harris, I am getting ready to give you some nausea medicine, so hopefully that will help with the way that you're feeling. And then we are going to get you some we're going to get you some insulin to see if we can get your blood sugar to come up, okay?
Or insulin?
No, where's the ampule?
Your medication's on the top of the cart.
There's
No,
no
that's my.
there's no ampules, Professor.
That big blue box? Dextrose?
We do now.
I can read.
Okay.
Okay.
So I need to
Totally the biggest thing on the cart, right?
Right?
4 milligrams. So I need 2 milligrams per ml. I need 2 mLs. Sorry. I'll work over here. Good?
What have you ever done this before? Do you know how to do this?
Mm-mm.
Okay. Okay, Mr. Harris, I got some dextrose in here for you. We're gonna get that blood sugar up, okay? Can you tell me your full name and date of birth?
Oh man, it's Arthur Harris. Born in August, I don't know when. I just can't say.
And do you have any drug allergies?
Some antibiotic, I don't know.
All right, sir. Hopefully this is gonna make you feel better. I'm just gonna clean this port off.
That takes the work.
What's that?
Take the work, I feel so bad.
We're here to make you feel better, sir. Whatever we can do to help you, you just let us know, okay?
you so much. You're so sweet. You guys can meet.
We're going pretty slow, okay?
Okay.
Okay, what we're gonna do is we're gonna recheck your blood sugar in about 15 minutes, okay? To see if this helped.
Okay. Thank you. And what about that medicine for my nausea?
I've got it right here.
Okay.
So I,
Great.
okay, Mr. Harris, I do need you to verify your name and date of birth for me again, please.
Arthur Harris, and I was
I'm just taking your pulses here.
212.
I'm gonna check your feet here. Do you have any numbing or tingling in your feet?
Little
No tingling.
little cold coming through your IV. How are you feeling, Mr. Harris?
I feel better. Thank you so much.
Mr. Harris, I'd like to take a look at your eyes. Can you open your eyes for me?
I don't want to do that right now.
No? Okay.
Later?
Well, we'd like to do it now. I just want to make sure you're okay.
Okay. Go ahead.
Okay, bright light. Just look at my finger. Okay, and I'm going to look in your mouth. Are you able to cough? Okay. Can you go ahead and swallow for me? Very good. Kristen?
Sorry, I didn't mean to do that. I'm just kidding. I gotta forget.
Oh no!
Did you reduce the stomach?
I did not know.
Okay, you know what? Let's listen to your. She just administered your